is Devin Wurman, and I'm a physical therapist here at Loudon Sports Therapy Center. Today I'm going to talk to you more about osteoarthritis. I'm going to just take my model here and show you. This is just for orientation purposes. This is the low back, and then this is the hip joint here, and this is the leg bone, which we call the femur. And what happens with osteoarthritis, there is a wear and tear of the lining of the joint. So for instance, this is your femur in your leg. You have a nice thin piece of cartilage that goes around the ball, and then that cartilage helps that hip move better, right? So what happens with osteoarthritis is that smooth piece of cartilage begins to wear down over time. And when that wears down over time, that means that the protection is no longer there. And when there's no protection there, that means that this bone of the leg is rubbing literally into the bone of the socket. And when that happens, that's when you have a lot of pain, a lot of issues doing your normal daily activities. And also what happens as well is sometimes excess bone forms inside there, and you get some what we call spurring, and that can impede the space inside the joint and cause a lot of pain. So arthritis is something that usually progresses over time. So as we get older, our chance of getting arthritis is more, especially if you were pretty active growing up. The other thing is that puts you at risk is if you're overweight. A lot of the excess weight that you carry can increase the amount of pressure in that joint and cause increased chance of arthritis. The other thing is just having a history of it in your family. If you notice that you've had several family members on one side of the family or not have issues with their hips, then you're just more likely to get that as well. What can you do for arthritis? So a lot of people that we see here in the clinic get really frustrated when they're told they have arthritis. They think that there's really nothing you can do, that you just have to live with it or wait until it becomes so significant that then they're looking at surgery. So there are lots of things we can do for arthritis, especially if you find it early enough. If you find out that you have arthritis or even just pain in your hip early enough, what we can do is strengthen any of the weak muscles that are around the joint of the hip. The stronger you have a support system around that joint, the less pain overall you will have, because there'll be less pressure going into that joint just from the bones themselves. So you give the bones and joint a support system. What else can we do? We can help you stretch, learn how to stretch, and teach you the tools that you need in order to be able to handle it on your own as well when you're done in therapy. When you come in therapy, if you're lacking some range of motion and you have tight muscles, we'll teach you the stretches you need to know in order to stretch them out more, as well as do some hands-on stuff. A lot of times the muscles around the joint get guarded and very tight. Sometimes spasms happen, so we can help alleviate all of that if you come in for therapy. The biggest thing is, as soon as you have discomfort, you want to handle it. It's a lot easier to handle it when it's very mild. As it progresses and you do nothing about it, that joint just gets worse and worse and worse, and then you'll end up finding out that you're bone on bone, and at that point there's no real hope as far as trying to prevent surgery, and you would have to have a hip replacement. Ultimately, we want to prolong that chance as much as possible. So coming into therapy will ultimately give you that ability to be able to do your normal functional activities, such as stairs, walking, standing, a lot easier, because we'll be able to give you those tools that you need in order to feel better.